It's been over a month since COVID-19 was declared a pandemic. More than 120,000 people have died and more than 2 million are infected worldwide. The health emergency has also affected the global economy and diplomacy. One of the countries that has been hardest hit by the pandemic is Spain. It's had more than 18,000 deaths despite the weeks-long government-imposed lockdown. Its already weak economy has declined further. And despite concerns by the World Health Organization, workers' unions, and opposition leaders, the Spanish government has announced a partial lifting of the restrictions. Prime Minister Pedro Sánchez has asked the European Union for help to tackle the economic fallout. Spain, along with Italy, France, and other EU nations, want to share the cost of the crisis through Eurobonds that all EU nations will have to pay off. But countries including Germany and the Netherlands oppose that plan, saying it will be a burden on their taxpayers. In an article published by newspapers across Europe, Prime Minister Sánchez warned that failing to respond with unwavering solidarity could push the European Union to fall apart. So, how will Spain overcome the challenges ahead? And will it succeed in its effort to unify the EU's response? The Spanish Foreign Minister Arancha Gonzalez Laya talks to Al Jazeera. The Spanish Foreign Minister Arancha Gonzalez Laya, thank you for talking to Al Jazeera.
A pleasure.
Foreign Minister Gonzalez, let me start by asking you about the fact that Spain has begun easing some of the coronavirus lockdown measures. How many people are going back to work, and isn't it too soon to be doing so?
So let me be very clear, we haven't yet started de-escalating the confinement measures that we took at the beginning of February to fight coronavirus. What we have done is go back to where we were 2.5 weeks ago in terms of letting workers go back to work, but only those that cannot do teleworking. And this is essentially, as we have seen, that the virus is entering into a phase of stabilization. But citizens remain confined in their homes and can only go out, as I said, to perform work that cannot be done through teleworking or to buy their food or their medicines. So we remain at the moment in a lockdown, in a state of alarm, because we have not yet reached a situation where we can start de-escalating with safety and security for our people.
And when would you reach that point when you can start de-escalating safely?
So we don't plan with months or 3 months ahead. We are doing this almost on a daily basis, on a weekly basis. We are evaluating the situation. We are looking at the figures. We are listening to the recommendations we get from the health experts, whether they are internationally, from the World Health Organization, from our own ones, from the European health experts, because what we have to do is start opening up, start returning to a new normal once we know that citizens will be safe, because otherwise we would have lost all the efforts that these citizens, in an extraordinary effort of citizenship, have achieved by remaining at home to avoid contagion.
You mentioned the World Health Organization, so let me just follow up, because the WHO has actually raised concerns about the lifting, about the easing of some of these restrictions by Spain and by other EU member states, and said that this could lead to a deadly resurgence of the infection. Does that worry you?
Well, no, because what we are doing is exactly what the World Health Organization is saying. What the World Health Organization said is do not lift prematurely measures that have been taken to prevent contact. And this is precisely where we are today. We are not lifting the measures that keep 47 million Spaniards in their homes. Precisely because we are taking the advice that we're getting from the World Health Organization very, very seriously.
All right, it's been announced that Prime Minister Pedro Sánchez will ask Parliament next week to extend emergency measures until May 11th. Are you confident that this will happen?
Well, again, we don't take bets. I don't think this is the time for taking bets or for speculating. What we have always told our citizens and this has been consistent, is that we will be guided by the recommendations we get from the health experts. And this is precisely what we are doing. What we have seen up until now is that by following their advice, we've been able to manage the pandemic, that we have entered into a phase of stabilization. We have seen the number of infected people decrease dramatically. We have seen the number of recovered people increase dramatically. We have seen our healthcare system, our hospitals be less burdened by new infected citizens. We have seen our intensive care units be less burdened by new patients. This is what we have achieved by being very careful. And this is what will guide the next steps. And if we need to ask Parliament for another extension of the state of alarm, we will do so in the best interest of our citizens.
Foreign Minister Gonzalez, U.S. President Donald Trump has announced that the U.S. will suspend payments to the World Health Organization. As Spain has been one of the hardest hit countries by the coronavirus pandemic, what's your reaction to that?
Well, we don't think that we should weaken the World Health Organization. If anything, this pandemic has told us that it's very important to strengthen the World Health Organization, to strengthen the ability of the global community to respond to the pandemic, to strengthen the ability of the World Health Organization to collect data, to issue recommendations, to provide with solid advice. We need more World Health Organization, not less World Health Organization. And let me take the opportunity to praise the incredible work that its Director General, Dr. Tedros, has been performing with a very steady hand at a very difficult moment for the global community. But we will have a time and a moment to talk about how to strengthen the World Health Organization. For now, we should not get distracted. What we should do is fight the pandemic strongly so that we can restart the engines of our economy and then go back to strengthening also the capacity of the international community to respond to pandemics like this one. This will not be the last one, so we need to be better prepared for the next one. And I think the World Health Organization will be an important part of that.
When you speak about being better prepared going forward and fighting the pandemic strongly, we must talk about the role of healthcare workers, because the number of healthcare workers who've been infected with COVID-19 in Spain is higher than in any other country in the world. What is being done right now by the government to better protect them, to provide them with the kind of equipment that they need to help people and to also combat getting ill themselves?
Yeah, let me first tell you that our biggest asset, whether it's in Spain or in any other country, are our healthcare workers. And our biggest asset is the solidity of our healthcare system. And this is why, in our view, one of the things we need to do moving forward is look into strengthening even more the capacity of our public healthcare systems to respond to shocks like this one. In Spain, we've gone through an unprecedented shock to our healthcare system. And by and large, with a lot of efforts from our workers, with a lot of efforts on the part of everybody within the healthcare community, we are coming out of this shock. But, and we've done that by obviously providing the necessary means to the healthcare workers. In Spain, which is a decentralized country, both the central government and all the regions have worked to provide the healthcare workers with their best means. But I have to tell you that this has been an unprecedented move, and therefore we have seen an unprecedented impact also on our healthcare workers. This is why, in our view, moving forward, we need to look very carefully at how we prepare better for the next pandemic, being humbled about what went right and what went wrong in this one, not only in Spain, but around the world, drawing the lessons and inputting this in terms of public investments in the future.
You mentioned that Spain is a decentralized country. I want to ask you more specifically about that. The fact that Spain has 17 autonomous regions, all with different healthcare models. How much did that complicate the response to COVID-19?
The decentralization in Spain is a function of wanting to bring the healthcare system closer to the citizens. So I think there is no structural issue. What we have to do, and this is what we have found in situations like this one, and again, with a model that is not very different from the healthcare system and the decentralization in other countries like Germany, which also has devolved responsibilities to the regions. What we had to do at the beginning is coordinate better the 17 models. And when we got to the hardest part of managing the pandemic, we took an extra step of ensuring that the government would have control, central command, but with decentralized action. For example, autonomous communities were free to purchase material, were free to implement the protocols in their best way, to organize their hospitals in the way they thought was the best, but with a central control and command, which was the Ministry of Health. It's a test in a way. It's the first time we test such a model, and I think what we have found is the importance of having this one place where the decisions are taken in a dialogue with the communities, but with a decentralized implementation of these measures to bring them closer to our citizens. Again, this is probably another element that we will have to look into when the pandemic is over. The Prime Minister in Spain made very clear and promised at the beginning of this crisis a commission in the Parliament to evaluate the impact of the measures taken, what went right, what went wrong. So this probably will be one of these areas we will have to look into.
If you're talking about looking into where things went right and where things went wrong, the Prime Minister has been severely criticized for not prohibiting mass gatherings sooner and for not stockpiling medical equipment once it was obvious that cases were increasing in Italy. Why weren't these measures taken sooner?
Well, again, from the humility we all need to exercise in analyzing how we manage the crisis, what went right and what went wrong. And this is as true in Spain as it is in any other country in the world, because I see this being part of pretty much the domestic debate in every country. In our country, we have to be humble. In the humbleness of this discussion, we have to also put a number of facts on the table. For example, first fact, Spain has been following the recommendations at every time that emanated from the World Health Organization, from the European Center for the Control of Pandemics, and from our own experts. And every time the measures and the recommendations were issued, measures were taken by the Spanish government, including forbidding gatherings. One, the recommendation was to forbid gatherings of the like that took place in the weeks before we took the state of alarm. So, if you wish, what we have always done in Spain is anchor the decisions we have taken on the basis of scientific recommendations and advice. Were we right? Were we wrong? In my view, we will have time to discuss this, and we will have to do this humbly, but we should start this discussion, I think, from the facts. The fact is that we followed the advice. Did we follow the advice? Was the advice soon enough? Probably not. Were we, countries of this world, and in particular developed economies, conscious of the depth and the velocity of transmission of the virus early enough? Probably not. And this is something that we collectively will have to look into. We want to do this in a humble manner, but also with starting from what we did. And what we did, again, is anchor our decisions on the recommendations we got at every time.
On March 8th, International Women's Day, there was a gathering of around 120,000 people that was allowed to take place in Madrid. to celebrate International Women's Day. There were already people warning that that gathering should not take place, whether or not it was happening in other countries in the region, and yet it was allowed to go on. This happened after the first cluster of coronavirus cases was discovered in Spain. Why was that particular gathering allowed to go on?
So again, to decide whether it's not that particular gathering, but the gatherings that took place around that weekend, which was International Women's Day, which saw a major political rally by one of the extreme right parties in Spain, which saw football matches, which saw sports activities, which saw religious gatherings. Why did all these gatherings happen? It's because when we look at the recommendation we got, we were not in the zone that was considered to be high-risk zone. Now, were these recommendations strong enough? Probably not. But it's easy to say this now that we have all the information that we have. It's difficult to take those measures when we have the information that we have. And let me also be very clear, this is one of the problems we have had, is that we did not know with enough depth of knowledge at the time, neither Spain nor Italy, nor France or Germany or the US or the UK, that the virus was traveling as fast as we now know that the virus was traveling, and that its degree of contagion was as high as we now know it's contagious. So on hindsight, it's very easy to make reach this kind of conclusions when you are in the middle of this. Let me tell you that we banned public gatherings, both with less affected people and less dead people in Spain than other countries that followed us. Did we do right? Let's look into that again with a lot of humbleness, but let's also not get to hasty conclusions based on one event and only one event, because that also would not serve us in the future to be better prepared.
Foreign Minister Gonzalez, you wrote recently in the Washington Post that as we fight the virus in Spain, we understand that our economic, social, and health security are all dependent on increased collaboration with our European neighbors. You also wrote in the same piece that we need unprecedented global coordination to jumpstart the engines of our economies so the shock is as short-lived as possible and no one is left behind. Are you now seeing that collaboration with your EU neighbors, and are you seeing it within the global community?
I think what we are seeing, at least at the European level, is we seem to have learned the lessons from the last crisis, which was the 2008 crisis. We are moving faster, we are moving in a more coordinated manner, and we are moving to protect jobs, all jobs, which was one of the lessons we take from the 2008 crisis, where we left many people behind. This time, we've learned the lesson. Now, the response in Europe has different actors. Some of these actors have already moved. The European Central Bank, the European Commission. Some of the responses at the European level are short to medium term, like the one we saw last week in the Eurogroup. But some will require, and this is where we are focused now, having a plan to restart the economies of Europe in a coordinated manner, but also in a very robust manner. And this is where we still need a bit more work in order to give ourselves the means to exit the recession in which all our economies will be in 2020, as we have heard from the International Monetary Fund. At the global level, I think there is space to do more, and a space to do this in a more coordinated manner. One of the other lessons we draw from the 2008 crisis is that when you've got a global crisis, and this is what we have today, as a recession in 2020 for the world, irrespective of where you are, irrespective of how big or small you are, irrespective of whether you are in the north or in the south, it requires synchronizing the responses. It requires investing in greater coordination. I know it's not very fashionable to talk about this these days, where some seem to be pursuing more national responses, but lessons of history, lessons from the 2008 crisis, we will be better off and we will exit faster if we do this in a more coordinated manner.
UniCredit research suggests that Spain is set to suffer more from the crisis than any other European economy. Unemployment in Spain was already at 14% before this crisis hit. 800,000 people have lost their jobs as a result. Madrid is now pushing for mutualization of debt and these EU-backed Corona bonds, but Northern European countries are resisting this. Where is European solidarity at this time?
So again, solidarity has taken its place in the measures that have been now agreed for the short term. Where we need to work a little bit more is in the medium to long-term response, and this is in two pieces. First, the budget for the next 7 years of the European Union, the budget, the means we will give ourselves to invest in priorities that make more sense post-coronavirus, and second, in the recovery plan, economic and social recovery plan, where we need to probably invest together in a mutualized manner, mutualizing the investments, not mutualizing past debts, but mutualizing our investment in the future. This is why we are a European Union. This is where we think, whether we are in the north or in the south, in the east or in the west of Europe, it's Europe that needs to exit the crisis. It's Europe that needs to strengthen its internal market and its ability to be a global player. And for that, it's Europe that needs to invest in a mutualized manner. That's what we are pushing for. And by the way, Spain is not the only one. This is what 9 leaders in Europe are pushing for. France, Italy, Spain, Luxembourg, Belgium, Portugal, Greece, Slovenia, Ireland. It's not a small part of Europe. And I am sure that this is shared by others. So we hope to see this budget and recovery plan. That means a collective investment, a common investment by the European member states in a common recovery.
Foreign Minister Gonzalez, there are opposition politicians and there are a number of regional governments that have also criticized the easing of restrictions or the potential easing of lockdown restrictions at this time. Quim Torra, who's the president of the regional government of Catalonia, had said returning people to work right now was irresponsible and reckless. Your response to that?
Well, I think we have a healthy debate in Spain with our different regions. It's part of our democratic game. We are a democratic country. In a democracy, you've got to have the ability to express your opinion, and the Catalan president expresses his opinion, and that's fine with that. But at the end of the day, once we have heard the opinion of everybody, we need a common plan. And that's where the government comes into place. The Prime Minister of Spain speaks with the presidents of the autonomous communities, with the regions, every week. He dialogues with them, he listens to their views, they put their ideas on the table, and at the end of the day, there is a plan, and it's the plan that is executed. Like in any democracy, space for dialogue, space for debate, including for opposing certain measures, but at the end of the day, a plan that needs to be executed, because at the end of the day, this virus knows no borders. And we will not win this battle in Spain unless we ensure that each and every one of our citizens is in the safe zone.
So we've spoken about the extension or potential extension of emergency measures in Spain, but I want to also ask you about the potential extension of border closures and travel restrictions, because the EU has recommended that those external border closures remain in place until May 15th. I believe that's the date that they've mentioned. Is Spain going to adhere to that as well?
Well, Spain believes that when you live in an integrated zone like the European Union, the lifting of borders has to be done in a coordinated manner, in a coherent manner. We share a common external border because we are part of the Schengen space. And this means that we need to discuss and agree what we do with our external borders together all European Union member states. We also have to discuss and agree what we do with our internal borders within this space, within the Schengen area. This is why we support the call by the European Commission when the Commission says we need to do this in a coordinated manner, working all of us together to get to a common response. Understanding that what we are learning also as we look at how the virus is behaving, until we are all safe, nobody will be safe.
Foreign Minister Gonzalez, I really appreciate your time today. Thanks for taking the time. We know that you're dealing with a lot. Best of luck to you and to everybody in Spain.
Thank you very much.